Initially, it was a struggle to decide which avenue or area I should study. Um, because bearing in mind, it must be remembered that ADHD has an effect upon family, friends, your educational standards, and access to the education systems, and also upon attitudes to the child or to the adult once they are diagnosed. Um, I'm also really trying to ascertain as to whether or not those who are diagnosed with ADHD are more likely to commit crime as a result of ADHD, or despite the diagnosis, whether or not ADHD and crime go hand in hand, or whether or not it's just literally a case of environment upbringing that will make somebody commit crime. Focusing mainly on the ADHD side, however. I intend really to take a look at other studies. I think I've already said this already, and I'd like to try to discover whether or not the prison population consists, truthfully, of more prisoners who have committed serious crimes than non-serious crimes, and that they have been diagnosed with ADHD or have got ADHD symptoms, and if they did the RDOS test, for example, or if they were tested on the DSM scale, whether or not they would actually be diagnosed with ADHD. Why did they commit crime? Why do people commit crime? I mean, the general status of a criminal is one that's, oh, I commit this crime because of boredom, I commit this crime because I didn't have what the other person had. The problem being is, with ADHD, for example, the fact that you act in a different manner, the fact that you respond differently to situations such as, well, I want that toy, you haven't given me the toy, but I want that toy, so I'm going to take that toy. It's a very, very childlike approach to life, which means you've got no consequences, you've got no thoughts of consequences, you've got no, well, hello, there you go. Now, many people turn around and say, oh, this is the endorphins, or this is the dopamine, or this is the other hormones and the neurons flying around in the brain and everything else, like a little mini short circuit. And when you read stuff like Driven to Distraction or Managing ADHD by these American doctors, Kit, I think, Kit Lawson, I can't quite remember his name, but I'll have to find that out eventually. I believe that it's trivializing what is going on. Yet you also see that it's purely based on children. Cognitive psychologists, for example, turn around and say that it's a shortcoming in the front of the brain, the limbic system, that which can control motivation. And Berkeley, in one of the videos I've seen recently online, he was giving a talk on what exactly ADHD is. ADHD, according to Berkeley, was not exactly attention deficit disorder with hyperactivity, because ADHD and ADD are two totally different things. ADD is without the hyperactivity, which is what most adults are actually diagnosed with. The reason they're diagnosed with it this way is because hyperactivity mellows. Most patients allegedly report the brain or feeling like you're driven by a motor, but not exactly jumping up and down out of your seat. In a child, that can be quite cute, but in an adult, that is not exactly expected, I suppose, would be the expression. As you can probably tell by my mannerisms, I do have ADHD, combined type. I have ASD also. I struggled for a number of years to be diagnosed, but upon reading my medical notes, I discovered that at 7 years old I was diagnosed as hyperkinetic. Now, hyperkinetic would be, I suppose, the precursor to hyperactivity disorder.